Hello everyone, here's another educational video from Safrebiz, and today I'm going to be talking about stroke and the warning signs and symptoms of stroke. You may have seen someone who had a stroke, or you may have heard about stroke, but do you know what causes stroke? Do you know the signs and symptoms of a stroke? Anyway, that's what I'm here to talk about today. Stroke is actually a medical emergency that occurs when someone had blood flow in their brain severely reduced or totally stopped. Without enough blood flow, the brain is deprived of oxygen, and the brain cells begin to die because of the lack of oxygen. The death of any brain cells means that whatever is controlled by that area of the brain, such as memory and muscle control, will stop. Let me give you a little statistics about stroke. A stroke happens every 40 seconds. Every year, about 800,000 people suffer a new stroke in the United States. Stroke is the fifth leading cause of death in the U.S. Every 4 minutes, someone dies from stroke, and that's very unfortunate. But the good news is that up to 80% of stroke can be prevented. Here are the warning signs of a stroke. You need to know this, because knowing the warning signs of stroke is very important. And actually, not just knowing the warning signs, you also need to know what to do when someone shows the warning signs of a stroke. All right? With stroke, time is very critical, because the sooner you get treatment, the less chance of serious damage to the brain. Here are the common symptoms of stroke. The symptoms develop gradually, so there is opportunity to notice it and do something to save the person. Number 1, numbness or weakness in your face or arm or leg, and this usually happens on one side of the body. Number 2, confusion or trouble understanding other people. The person who is having a sign of a stroke will not be able to understand when you talk to them. Trouble speaking. Not only that the person will not be able to understand, they will not be able to communicate or speak clearly to you. Trouble seeing with one or both eyes. The vision will be blurry, and the person will not be able to see clearly, and they may even complain to you that they can't see clearly. Trouble walking or staying balanced or coordinated. A person who is having signs of a stroke will not walk normally. You tell them to approach you, they will not be able to walk staying balanced. Severe headache that comes on for no reason. Usually, a headache may happen because of a reason, but in this case, the person all of a sudden start complaining of severe headache for no reason. How do you diagnose stroke? You may not be a doctor, but there is a simple way to diagnose and tell if the person is actually having a stroke symptom. And there is an acronym for it to make it easy. The acronym is FAST. F-A-S-T, FAST. F stands for the face drooping. So the person, you look at him, one side of their face droops or feel numb. If you ask them to smile, you look at them, their smile will be uneven. It won't look like the normal smile that the person usually have. A for arm weakness. A typical sign of a stroke is that the person will have one arm very weak or numb. If you ask them to raise both arms up, you will notice that one arm will be drifting downwards. They will not be able to raise both arms up because that side of the body has been weakened by the death of the brain cell on that side of the body. S for speech difficulty. A typical sign of a stroke is that the person will have problems speaking clearly. Their speech will be slurred. They will not be able to be understood. If you ask them to repeat a simple sentence, they cannot repeat the sentence correctly. T for time. It is really important that you call a medical emergency services. You call 911 in the United States. Of course, in other countries, the number to call for medical emergency may be different. In United Kingdom, Germany, Canada, or Africa, a country like Nigeria, they may have a different number. So it's really important that you know the number to call for medical emergency services to come help the person. Let me say this again. What do you do when you notice these signs? It's really important. It's not just noticing the signs. You need to know what to do. Number one thing, you need to know that you do not ignore the signs and symptoms of a stroke. Even if the signs are weak or they come and go, or even if you notice only one sign, it's really important that you do not ignore it. The second thing is that you do not waste time. Do not wait, because for a stroke, every minute counts for stroke survival. Number 3, like we said before, I'm going to reemphasize it. It's time to call for emergency medical services, for ambulance to take the person to the hospital. In the US, the number is 911. In other countries, they may have a different number. All right? Then the last thing is you need to know the time that the person started having the signs and symptoms, because this time needs to be reported to the medical professional, the doctor, that will be taking care of the patient when they get to the emergency services. All right? There is a link that I put here for my blog on stroke and stroke signs and symptoms that you need to click on so that you can read and get more information on this. And you are welcome to comment or ask questions, or you may even subscribe to this new YouTube channel so that you can continue to get more educational information from Safrebiz. I thank you for watching, and I hope to get back to you next time. Bye-bye.